Okay, Sib, thank you so much for joining us today for our Mother's Day campaign, all the way from Alabama. Can you first just tell us what your job is at One Heart?
Yes, I am the Chief Operations Officer at One Heart Worldwide. So I've been working with One Heart for almost 19 years in one way or another. I started in 2001 with a project in Tibet as a consultant, supporting their programs when we started developing the network of safety. I've been integral part of the development of the network of safety with Arlene since the beginning. And I joined One Heart full-time in 2010 when we started the Nepal project.
Awesome. And why is maternal and child health important to you?
Good question. Well, it all started 20 years ago with the birth of my daughter. And what happened is I faced some problems during delivery. I had obstructed labor and I had postpartum hemorrhage. And I was delivering in a really top level maternity hospital with a really good medical team. And even then, we barely made it. And I've got to admit, that was a very strong wake-up call for me. I just realized that without that hospital and the team, we wouldn't be here today. And, it just hits really hard. And, from there on, I had always been working in reproductive health, but that was more STD and HIV prevention. But following that, it really created a career change for me, where I felt that every woman needed to have, the basic access to care that I had, proper care, good, well-trained, health provider. And I realized that so many women do not have access to this basic human right, and decided that needed to be the direction of my work. And, luckily, less than a year later, I met Arlene, and, the rest is history.
Okay, so why don't you tell us more about that? How exactly did you end up joining the One Heart team?
Well, I was working in academia at the time, and I had a grant in Pakistan that was related to maternal and child health, but more with HIV prevention. And we met at an NIH meeting, and Arlene, Arlene being Arlene, decided that she needed help in the Tibet project, and I needed an epidemiologist. I'm an epidemiologist by training. I have a PhD in perinatal epidemiology. And so she's like, well, you need to come help me. And so I did. And, I came in on board. That's when I came in on board as a consultant, mostly to help with the data of the Tibet project. So
that is a crazy aligned story of personal meets professional. Seems like the stars really aligned there. So now that we're getting to celebrate, bringing healthy access, good care to mothers, what would you like to say to our supporters this Mother's Day?
Well, everybody's got a mom. You cherish your mom. I think we should all work together so that everybody else gets a chance to keep their mom and not lose them, and to be able to cherish them as well. So, we are very lucky here. Very few mothers comparatively pass away in the US, and compared to, for example, Nepal. And I think that every child in Nepal deserves to have their mom. So I'd like to ask everybody to consider donation to One Heart, even a small one, even if it's just the price of your Starbucks coffee today. Anything goes, every dollar counts to the fight, and anything that you can provide for us to help us, particularly now that we are facing this COVID epidemic in Nepal, it is even more crucial for us to make sure that every woman has and continues to access care.
Thank you so much for joining us, Sid. We love you, and thanks for everything you do for us.
Thank you for the interview. It was wonderful. Happy
Likewise.
Mother's Day.
Happy Mother's Day.